Well, folks, I am so happy to invite Dr. Brian Day from Canby Surgery Centre onto Coastal Front's studio today. Born in Liverpool, UK, Dr. Day graduated in medicine from the University of Manchester and later completed his orthopedic specialist training and trauma fellowships at the University of British Columbia. Dr. Day proceeded to set his practice at the Vancouver General Hospital and UBC, where he developed his expertise in orthopedics, sports injury, and arthroscopy. With several achievements under his belt, here are a few that we'd like to highlight. Dr. Day is the recipient of the Canadian Orthopedic Association's Edward Sampson Award for Outstanding Research, past president of the Canadian Medical Association. Today, Dr. Day remains a physician staff member at the Vancouver Coastal Health, an honorary associate professor at UBC, along with being the medical director for the Specialist Referral Clinic and Camby Surgery Centre. Outside of the medical industry, Dr. Day is husband to Dr. Nina Bland and is father of 6 children, and he's also a toffee, which will let you explain to the listeners what that is. Today, in the podcast, we are going to be discussing the current healthcare system in Canada, as well as the potential impacts of privatization. Dr. Day, thanks for being on the show today.
Oh, you're welcome.
So let's start off by what is a toffee?
So in Liverpool, there are 2 football teams. You call it soccer. We call it football, real football we call it. And they're Everton and Liverpool, and Everton are known as the Toffees. And they were the original club in Liverpool, and Liverpool Football Club, which has risen up the rankings, was an offshoot early on, over 100 years ago.
So if I'm over at your house, I should definitely make sure I'm not wearing any red.
Yeah, no red.
No red, okay.
Except a poppy. A poppy's
okay. Poppy's fair. Yeah, okay, fair enough. And I'm wearing mine today. Okay, Brian, we're going to spend some time today to talk about the universal healthcare system we have in Canada,
yes,
and the challenge that you've got going on in the courts today,
yes,
as well as your private clinic that you've got, and help shed some light on what the other side sees here. Because what we normally hear about is how, especially external to Canada, you always hear reports about how Canada's got this great universal healthcare system. So let me start by asking you, Canadians have a view, generally speaking, that we have this fantastic universal publicly funded healthcare system that we take a lot of pride in, especially when we travel to the States. When we get into conversations with our American counterparts, we say, well, in Canada, I can go and get an operation if I'm sick. I can go see my doctor, and I don't have to pay anything for it. Can you explain to our listeners what it means to have universal health care, and what does it mean that it should include?
So the description you gave was accurate when I came to Canada, and it was like that for 10, 15 years. And then it gradually started to get a reality check, because we tried to provide everything to everyone in unlimited amounts, and we couldn't do it. And so over the years, what Canada's system has evolved into is a system of rationing. So we now severely ration access to healthcare in a way we didn't 30, 40 years ago. And so the system is now at a state where hundreds of thousands, actually in BC, hundreds of thousands, across the country, millions, are waiting on wait lists for access to care. And many of those patients have cancers. They're not just, or heart disease, they're dying on wait lists, some of them. And that's something that we find, as doctors, we find unacceptable. And just to correct a little thing, there's a feeling among many people that this is a system Canadians support, but actually 80% of Canadians, according to 80% of British Columbians, according to an Ipsos poll, don't support it. They want change. And yes, we rank, in a recent ranking of health systems, we came out ahead of the United States. They ranked 11 countries. They were ranked 11th, and we were ranked 10th.
So we beat the Americans, but we're well in last place.
Yeah, and sometimes Canadians are like that. As long as we're better than America, the United States, but.
And what you're saying is we should be aspiring to be in first or second, not.
Yeah, I think.
Do you know out of interest what country came in first or second in that list?
Well, countries, it generally changes up and down. Like in the year about 20 years ago, the World Health Organization did a ranking, and Canada came in 30th in the world, and the United States 37th. At that time, France was number one. Today, it varies from countries like Norway or Singapore, Switzerland. But I've worked in Switzerland, and they have what you would call a very strange system. They have universal health care, but it's not publicly operated or publicly funded. It's based on private insurance and mostly private delivery, but the government or the canton pays the premiums. So it's still universal, but they offer much more than we do. We don't get prescription drugs, we don't get physio, we don't get dentistry, we don't even get an ambulance for under our system. So it's not really what we think it is.
Okay. Now, you started Camby Surgery in 1996.
Yes.
What made Camby Surgery at the time of opening different than what if I'd gone to go through the public health care system in 1996?
So the reason we opened it is a group of us got together and
a group of doctors?
Yes,
okay.
and some some in the business community, some well-known, long-standing supporters of the public health system, like Jack Poole and Milan Illich. Our shareholders, our founding shareholders, a lot of them were in the business community. They've donated over $100 million to the public health system in BC, and so these were not but they recognized there was something wrong.
These weren't anti-public health care people.
No, they weren't anti-public health people. And what was happening is that surgeons, mostly surgeons back at the beginning, and anesthesiologists, and their time in the public system was cut back progressively over the years. I started off with 22 hours of operating time a week and was cut back to 5 hours a week. But I had 400 patients waiting to get into hospital. If you can only operate on 2 or 3 a week, that doesn't work.
What was causing this cutback?
Lots of reasons, but basically money. The government had promised this system and couldn't deliver, and they weren't funding it. They didn't have the funds, and
when you say government, we're talking about provincial government?
Both, provincial government and federal government. I mean, healthcare is constitutionally under the provinces, but the federal government basically gives some of the taxpayer money they take back to the provincial government,
right?
As a which is in some ways contrary to the origins of Canada, because under the original federation, healthcare and education were supposed to be just provincially operated, and that's why there's no provincial Minister of Education. But for some reason, the federal government got into healthcare and probably shouldn't be there.
Now, Brian, that was 1996, roughly about 25 years ago. How has that changed to today now? What is Camby's purpose, what you're doing at Camby Surgery and the specialist referral clinic? Is it different today? Have you grown? You obviously have a court case as well. We can get into that in a minute, but just to talk about what the Camby Surgery Group does today.
Well, essentially, one of the analogies I use is like, as we had, if you were a mechanic and you had customers with cars to fix, and the customers couldn't get into the garage that the government owned, and the mechanics weren't allowed to do their work in the garage that the government owned. So what we did as an analogy is we went and built our own garage and let people come. But our original patients we focused on injured workers compensation. And the Workers' Compensation Board is still our biggest client, if you will, because they recognize as much as anyone that keeping people off work, paying them and having them out of the workforce, and with a disability that's going to get worse with time if it's not treated in a timely way, they recognize they need to do something about it. So there's a strange paradox in our universal system that injured workers get priority over people who have the same injury but didn't do it at work.
Yeah. Well, I've got an interesting, maybe I'll jump to this. I've got an interesting question for you, for listeners to hear this one out. So you've got 4 people all in Whistler, okay? One of them is a BC resident. and one of them is a friend of theirs who's an Alberta resident. They're out skiing in Whistler. And unfortunately, they both break their legs while they're skiing. You also have an ambulance driver that on their way gets in an accident themselves, sadly, and they also break their legs. And they're in a vehicle, driving an insured vehicle. And the ski instructor also broke their legs on their job. So you've got one Alberta resident, one BC resident. They're just casually skiing with a paid instructor. They all three of them break their legs. And then the person working to take these people to the hospital also breaks their leg. Of those 4 people, how many of those people could you operate on?
Well, I mean, breaking a leg is perhaps not the best. So maybe wrecking a knee or tearing a major ligament injury.
Yeah.
Because breaking a leg, you go to the emergency department and you'll wait a long time still. But
say like
but
they all wreck their knees.
Yeah, but if they all wreck their knees,
yeah.
Yes, the only one that would have to wait sometimes well over a year is the BC resident. And actually, we had that example. Like I was during the Winter Olympics in 2001, I think, in Vancouver. We were looking after the Olympians from all over the world, and so we were treating Russian gold medal. I treated a Russian medalist, an Australian medalist who got injured, and we also treated the BC resident Olympian or the Canadian Olympians. But if they were from BC, we were breaking the law to treat them. They were supposed to, in theory, go on a long wait list. And to show how ridiculous it was, it is now. A couple of weeks ago, I was at our clinic treating 2 Albertans, and a colleague in Alberta was at a clinic there treating 2 BC residents. They've each had to cross the border, because once you cross the border, it's like being in a different country. You're a foreigner, and so
this doesn't make any sense at all.
It's completely illogical. Yes, and I think what we
and
have
just to make sure we're clear, Brian. Going back to the reason I used the working on the job and driving a vehicle was I was referencing WorkSafe BC and ICBC.
Yeah.
So WorkSafe BC is BC's publicly funded monopoly on workers' compensation.
Yes.
And ICBC is the province's taxpayer-funded monopoly on car insurance. And these are both 2 of your largest customers at Cambie.
Yeah, to be fair, the workers' compensation, I think this is important. It's a privately funded insurance scheme.
Is it?
Okay. Because the only funding the Workers' Compensation Board gets is from employers.
Okay.
There's no tax dollars. But it's an example of private insurance operating in British Columbia.
Right.
And I think
it's a good parallel to what
So basically, what we're saying is, if someone's injured on the and not on the job, they should have the same privileges, and even more is the fact that we are unique as a country in this way. Like we love to compare ourselves to the United States, but we are unique in making it unlawful to look after yourself when you're unwell or injured.
Okay, well, this is a good segue into the systems that exist in our planet. So let me just use two systems that kind of really contrast each other, and then I want you to tell me where Canada fits in this. So over on one side of the spectrum is a free market system like you have in the United States. I may not get this completely right, but go with what most Canadians understand. So on one end of the spectrum, free market system in the United States, largely paid for through insurance from employment arrangements, but you could have private insurance, but it's not a public system. And then the other end of the spectrum, you have like a communist system where everything, all services are made available to the public by the government. Where would you rank Canada in this spectrum?
So just to call it a communist system, one of the things that's most interesting is most of the hospitals in communist China are private hospitals. So just to verify, yes, Canada doesn't have any, and where we rank is unique because there is no country in the world where it's unlawful to obtain private health insurance except Canada, and that's shocking to some people. And also the U.S. We usually think of the U.S. as a
So you're saying we're worse than the communists?
way worse,
At least when it
way
comes
more
to public,
extreme,
at least when it
way
comes
more
to
to the
public
left
okay.
of the communist
Way
countries.
more to the left
Yeah,
of
way
communist
more to the
countries.
left when it
at
comes
least
to
when
healthcare.
Healthcare, okay.
Yeah, and also the
Not freedom of
Americans.
speech, thankfully, but
Well, we think of Americans and the United States as being a free market system, but actually, if you're over 65 in the United States, you're covered by Medicare.
okay.
And if you're in the lowest income groups, the poor are covered by Medicaid, and they're state operated and federally operated in some cases, and then there are the vets. And the other thing that's interesting about the United States is they actually don't have a free market because there's a lot of restrictions on state-to-state insurance companies. So it's an example where the U.S. falls down, and I'm not here to defend the U.S. system because it has a lot it needs to do. But we do have to bear in mind that at its best, it offers the best. I mean, it has some of the best technology, the best drug. I mean, we've seen with COVID how Canada has depended on the United States to relieve ourselves of the COVID crisis. And so
You're talking about with vaccinations, for example.
Yeah.
Ironically, with Pfizer, but we had to get it through Europe because.
But it's the hub of the research that leads to most of the top technology in medicine, including drugs, is from the United States. There's no question about that. And Canada has driven a lot of these innovative corporations out of the country. We've said we don't want big pharma, and we don't want the jobs they bring. We don't want the investment they bring, which is silly.
Let's maybe spend a bit more time talking about. You just pointed out how the United States has some of the best medical advances, services in the world.
Yes.
So look, in talking about the United States, I mean, there's some real intense debate going on in the United States right now around healthcare reform. If Canada were to reform our healthcare system, what aspects would you take from different models around the world? I mean, one, for example, I know you've talked about before is the UK Care Guarantee Program. So can you maybe speak to that one? And then if there's any others that you can come to mind as far as other aspects. You've obviously seen systems around the world. You understand them. So tell us, what would you do?
I lived in Switzerland for a while, and they have, as I said, they have an interesting universal system where it's based on private insurance. But if you are in the low income group, the government pays the premiums. Holland's somewhat the same, interestingly, there is a care guarantee in Britain, which has 10% of the population of Britain have private health insurance. It's optional, and what's interesting is a lot of those people are government employees.
Really?
Yeah, to get private.
Because they get it through their
through the government. Yeah.
Right.
And
it's part of their benefits package, so to speak.
Yes, and just talking about going back to the U.S., Obamacare. We think of it as kind of a socialist system. It's based on private health insurance and private hospitals mostly, but the state will cover people and pay the insurance premiums, kind of like in Switzerland, for those that can't afford it. Now the U.S., I'm not going to support the U.S. system because the biggest problem they have is uninsured services, and the Americans have this. They really want the greatest and the latest, and no country can afford to give that to everyone in unlimited amounts. So there has to be some rationale, but there are features of many of these systems. So the British healthcare guarantee is that from the time you see a family doctor until if you need, say, a hernia operation or a knee operation or a back operation, from the time you see the family doctor and they say you need to see a specialist and have surgery or a procedure done, till the time you've completed the surgery has to be a maximum of 18 weeks.
Really?
And that includes getting an MRI if you need it, getting any tests, seeing the specialist, being booked for it, and having the procedure done. That maximum from the time you were in your family doctor's office, 18 weeks. And beyond that,
what happens if that doesn't occur?
Then the government funds you to go to any public, private, even in Europe. That might have changed a little bit after Brexit, but until Brexit, it was any public or private hospital in Europe. The government would, in the common market anyway. So
just make sure I'm clear. Let's use my own case as an example, because as you know, you actually operated on my knee, for full disclosure, and you did a great job, by the way. And so I've hurt my knee just playing hockey. It wasn't through work. It wasn't through driving a vehicle. You're saying if I lived in the UK, that the obligation of the healthcare system in the UK is that within 18 weeks of me being diagnosed by my GP that I need surgery, which includes the process of getting x-ray, MRI, that kind of thing, that within 18 weeks I need to be lying on a bed with a doctor like you working on my knee.
Yes.
And if they don't deliver that, they have to pay, the government has to pay for me to be able to get access private healthcare through like an institution like Camby.
Yeah.
So not only is it not illegal, it's actually an obligation of the government to pay for this service.
Yeah, but often, the other thing that's different, the other thing that's very unusual about Canada is that we primarily fund our hospitals with a fixed annual budget. We call it a global budget or block funding. So if, for example, I'm making up this figure, but supposing Vancouver General Hospital is given $1 billion a year to run the operations and the operating rooms, every patient that goes to the hospital is using up their money. And that explains a lot. Whereas in England and in every other OECD country, every other developed country, when a patient goes, even within the universal system, the hospital gets revenue from the government. So a hospital in England that treats no patients will have no revenue.
Okay.
And so if you're the chief financial officer of a hospital in Canada,
so it's a variable cost or revenue versus fixed.
Yeah,
which makes a lot of sense, because
the chief financial officer of a hospital in Canada, the last thing they want is patients, because it's using up their budget. So financial success is if you still have $1 billion at the end of the year. I'm exaggerating a bit, but just to make the point that in England, what happened when they introduced money, what they called PBR, but anyway, it's payment by results. Public hospitals that were performing well and could attract patients got more revenue, and so there was that's a kind of an internal.
Good example of,
they call it an internal market, that there is an incentive for the hospital that patients want to go there because they give good service, they have good doctors and nurses, and they treat the patients well. Whereas in Canada, you go to a hospital and I'm not saying this about the staff, the doctors and nurses still want to look after the patients, but in terms of the overall management of the hospital, a patient is consuming their budget.
Wow, fascinating.
It's a crazy system.
When it comes to driving policies around care, how you're going to operate, there's two very different thought processes going on for these CFOs of these hospitals or the CEOs of these hospitals.
Yes,
based on your description.
Well, we haven't talked about it, but one of the fastest growing businesses in the world, if you like, is the business of medical tourism. It's where over 200,000 Canadians before COVID were going abroad every year to get mostly, but to the US, but elsewhere, to get surgeries. And you can multiply that by 10 for the United States. They were going abroad too, and we are.
And you think this is just a great example of what, because a testament as to why that our system's not working?
Our system, if we change, even if we just change our funding system, like we're closing down hospitals at 3 o'clock in the afternoon sometimes. We could, because we don't have the money to run them. The patients will use up their money. We don't have the budget to do it, because
There's hospitals closing at 3 in the afternoon.
the
in British
operating
Columbia?
rooms are closing. Yes.
Really?
When I was one of the first people on staff at UBC Hospital in 1981 when it opened, and we had a 24-hour emergency department and would treat fractures. Now it's closed at, it closes in the evening.
I'm always perplexed by UBC Hospital because I live up in the same area that you live, near UBC there. And anytime I've had to go there, maybe 4 or 5 times with my young children, and my daughter, just had a sprained ankle or whatever, it's always such a great place to go. But I look at this huge facility and think to myself, like, it seems very underutilized. Like,
Right.
It's a big facility, but it seems like there's very few people there.
Yeah. Well, it's underutilized because they don't have the money to operate it. And, one of the statistics that COVID has brought to light is the fact that we are desperate for hospital beds in Canada. We're ranked 51st in the world in number of beds per population. And
Wow.
And that's not very good for a country that's ranked in the top 3 or 4 for spending on healthcare. But
you just answered one of my questions. This is so we're one of the top 3 in the world for spending on a per capita basis, but we're ranked 50th as far as beds per capita.
And 26th.
Where's all this money going, Brian?
So we're ranked 26th in the number of doctors per population. When I came to Canada in the 70s, we were fourth in the world in the number of doctors per population.
Are you talking about GPs or just all
doctors? Yeah, all doctors. So
can you explain this for the listeners? Because first of all, I think what's fascinating about this is I think a lot of listeners like myself don't even realize. Do you think that's part of the problem? Is there a lot of Canadians that aren't in the medical field like yourself that don't even realize there's a problem here?
Well, until you need healthcare, you don't know. The promise is there,
right?
But then once you need it, that's when you realize, it's not delivering. Now, sometimes it does.
We had almost an identical conversation with Troy, the head of the BC ambulance service, just like a month ago. He said the same thing.
Yeah.
So you don't realize how much you need your ambulance until you need your ambulance.
Yeah. And it's the same with all healthcare. At any one time, only a few % need it. So if there's a promise from the government to deliver healthcare, and they don't do it, only the 2 or 3% are angry. And Canadians are very accepting of government control, I think, in a way that many other nations, the people are not.
And complacency.
Yes.
We still have Justin Trudeau as a Prime Minister.
We just accept that, accept things as they are.
But you're saying that we are the top 3 spenders by per capita basis.
Yeah, the U.S. is well above the others.
Okay, but let's not compare ourselves to a country that ranked 12th and we ranked 11th. My question to you is, where's all this money going? I mean, if we're paying that much money, it reminds me, I think, of like another parallel would be like the U.S. spends, I think, more money on education than almost any other country in the world per capita, yet they don't rank very well, globally on education for young people.
Right.
So where is this money going, Brian?
So Canada, for a population of about 36 million, we have 14 health ministries. We have federal, provincial, territorial. France, with double the population, has 1. And so every health ministry has a health minister. They all have deputies. The deputies all have associate deputies. And one of the statistics that stands out in my mind is that we have, on a per capita basis, 11 times as many public health bureaucrats as Germany does.
11 times?
Yes.
As Germany?
Yes.
Which a lot of people would, when you compare things to like Switzerland and Norway, but Germany is a bigger country than ours.
Yeah. Very modern. So we have, for every public health bureaucrat we have 11. And that uses up a lot of money.
So what you're saying, and maybe one of the solutions here, is just to consolidate. I mean, would you consolidate down to the level, for example, of the health authorities within BC? I mean, I guess there's no really reason to have a Fraser Health Authority separate from what's the other one called? Fraser and Vancouver Coastal.
Well, It's probably not at that level. I kind of joked to someone once, what's the first thing you'd do if you were the Minister of Health, I was asked. I said the first thing I'd do is close the Ministry of Health and just have the finance ministry send the money to the hospitals. I immediately would save billions of dollars.
So what you're saying is the Ministry of Health in British Columbia really doesn't do much for patients or for taxpayers for that matter. They just burn through the cash on its way down from the federal government transfers to the provincial Ministry of Health, and then from there down to the health authorities. Just send it straight to the health authorities.
There are buildings in Victoria where the whole building and its staff is devoted to wait lists management and counting them and measuring them. Well, guess what happens if you eliminated wait lists?
Right.
They wouldn't have a job.
This legal action we're talking about here is against the provinces, the Medicare Protection Act, and you did this in 2009.
Yeah.
So you launched this action against the province while we had a BC Liberal government in power.
Yes, because what happened is the BC Nurses Union went to court. There have been laws on the books since the beginning of Camby, if you like, which basically outlaw private insurance and private funding for health care. But we had opinions from Canada's probably the leading two constitutional lawyers in Canada. One of them was Peter Hogg, who writes the standard textbooks for law schools on constitutional law, that the laws that said that people suffering on wait lists have to stay on wait lists and can't use their own funding or insurance are unconstitutional. So we operated under those on the premise that even though we were, if you like, in violation of provincial laws, those laws were unlawful. Just like the history is full of unlawful laws. Like, when I was a kid, you were not Muhammad Ali was not allowed to go in certain buses or in certain restaurants, and in Canada there was a time when women didn't have the vote. These were laws that were unconstitutional. And then we've had the Morgenthau, the case on abortion, that was illegal. And then we've got same-sex marriage, we've got prisoners' rights, we've got assisted dying. All of these issues have been shown. It used to be, when I was a kid, illegal to commit suicide. Well, I mean, people who commit suicide are mentally ill, and they do it in a state of mental illness. If you survived, you could be charged. You could be charged with an offense. So these laws were all found to be
so odd. Yeah.
Odd and illegal.
So you're pointing out that you're pointing out that we've made a lot of progress in Canada.
Well, we haven't, because those laws are still there. And that's what our constitutional challenge is about, striking down those laws as they were struck down in Quebec in 2005.
Mm-hmm. Is this the case called Chowley versus Quebec?
So in 2005,
maybe just so for listeners to understand, who's Chowley? Everybody knows
so
the province of
Chowley
Quebec.
was is a French doctor who launched this suit. At the time he launched it, France was the #1 ranked healthcare system in the world according to the World Health Organization, and so he was used to a good health system, and he found that his.
So he's French.
He's from France, yes.
But he was living in Quebec.
But he was living in Quebec.
Okay, gotcha.
And just thought this was crazy that things weren't like they were in France, which was the #1 ranked system, and he understood that the reason, even though there was private hospitals and there was private insurance in France, that what that did is introduce a little bit of competition for the public system, and there was a yardstick by which the French could judge the French system. Here in Canada, one of the greatest problems governments have with us is that we make them look bad. I mean, whereas
is that genuinely like one of the issues?
Yes. So if we didn't exist, the system wouldn't look as bad, but because you wouldn't know any better.
Yeah.
Unless you travel outside the country. So Jack Chowley mounted a case, and it got went all the way to the Supreme Court of Canada. He lost it at the Quebec levels of the courts.
Okay.
Went to the Supreme Court of Canada, and they ruled it was unconstitutional for someone from Quebec to be denied access to buying private health insurance, and our case is basically.
And after that happened, what did that mean? And if I'm in Quebec now, I could.
Well, it meant that in law, but the Quebec government didn't necessarily obey the law. They introduced certain restricted access to private insurance, and then there were political issues where the government was told by certain groups that if you enforce what you've just been told to enforce, we'll hold back on our support. And so it never really, but what it did result in, which is interesting, is a care guarantee, and yes,
in Quebec. Okay.
And our basic one of the things we're arguing in our lawsuit is, should a patient suffering or dying on a wait list in BC have the same protection under the charter that the Supreme Court of Canada gave to people in Quebec suffering on wait lists?
Right,
and we say yes, it should.
Sure. Yeah. Well, they shouldn't be treated any better than we should. We're all Canadians, and we're all.
Well, yeah, and that's what we're arguing for in court.
Are there people dying on wait lists in BC today?
Oh yes. In evidence in our trial, just from 1 year at Fraser Health, 308 people. That's just one health region died on a wait list in 1 year. That you can imagine.
When was that done?
That was 2015-16. That's the only year we could get. It's hard to get this data, but that is in evidence.
So one health region going back 7 years ago, way before COVID, where hospital and medical services have retracted significantly.
Yeah.
You had over 300 people in one health region die on a wait list.
Yes.
Are there people today in BC who have cancer and are likely going to die because they didn't get treated in enough time?
Through
the public healthcare system?
Of course, yes. I mean, we know. We had to
heart
extract
attack as well? Or?
We had to extract data from the government. They were very reluctant to put it in.
Provincial government?
Yes.
Okay.
We had to call quotes a hostile witness, and we got into evidence in certain cancers. One of the things that's happened in BC, and this wasn't the case in Quebec in 2005, is we have government-mandated maximum acceptable benchmarks. The BC government has actually endorsed these. And certain cancers in BC, only 13% of the cancers are being treated in the time that the government says it's safe, the maximum safe time. So
only 13%.
13% of certain.
So despite
cancers,
all the cancer research that we do in this province, which I know is a lot, you're telling me that as far as delivery,
they're not getting treated. They're not patients. Patients are being neglected. Patients with cancer and heart disease and urgent medical conditions are also put on wait lists and not being treated within the maximum acceptable time that the government has deemed they should be.
And do you think COVID's going to cause this when the stats come out a year or two from now? Do you think we'll see it's even worse?
There are modeling studies from McMaster that show a year or so ago showed that they thought wait lists would go up between 4 and 7 times, and then a year later they've renewed that. That was in 2020. This year they revisited that study, and they said we think we've underestimated. So it's going to be drastic, because right now we don't know how many people are waiting. We do know there's a lot of false data being put out from BC on, or there's no minimal data that they have a website that makes no sense if you just look at it. They've got, well, it's similar to when I was at UBC. You went to the government website on wait lists, and it showed that I had 10 people waiting for surgery, and I had 400 waiting. And I'd walk into the clerk at the operating room and said, well, how come the data shows 10? She said, I don't know, there's 400.
Wow.
that's going on today.
So not proper collection from the government, or they're not being transparent with
They're not being transparent. I mean, the transparency was one of the things we wanted to get out in the courtroom. Actually, Post Media, which is, owns some of the big media outlets in the Vancouver Sun and so on, they asked for permission to televise the trial, and we supported it because we thought the public have a right to know what's going on with their health system, but the government opposed it, and the judge would not allow it to be televised.
That's amazing. So where are we at on this court case today, Brian?
So in June, in September of last year, we lost at the lower court. Our lawyers and we both feel there were many, many errors in law and in findings of fact, and the findings of fact would be shocking to. I mean, there were certain findings of fact that just make no sense. For instance, one of the findings of fact was that if you wait longer than 6 months on a wait list, you get 8% better every month, which means no one would ever need any surgery.
Because after 12 months, after 100
you'd eventually
months,
everyone gets
months,
better. Yeah. It's a nonsense, but it was a finding of fact.
Okay.
And but then the real the appeal court is constrained in the BC Appeal Court, which heard our appeal of that decision in June of this year. They can't really in detail look at the facts because they don't hear the evidence. They're just looking at the trial record, and some of those facts were badly misinterpreted, and they will look at those. But there were also, we believe, and our lawyers believe, and lots of lawyers across the country believe, there were many errors in law, and those are appealable. But whatever happens, we're expecting that decision within the next couple of months, we hope.
Okay.
And then whatever happens, it's headed towards the Supreme Court of Canada, just like Chaoli did. And unlike Chaoli, this case will have application in every province, because Chaoli was the Supreme Court of Canada only the ruling in favor of Quebecers was under the Quebec Charter, because they have their own
which is
charter.
different, and I think
but it's very
know that.
similar. Very similar.
Yeah. But so what you're saying, just to make sure I dumb this down, is that if you have a similar ruling or any kind of success with this at the Supreme Court of Canada, it will affect all provinces across Canada.
Yes. Yeah.
Because Quebec kind of operates separately from the rest of the country.
Yeah. They have their own constitution, but it's very similar.
Yeah.
And one of the judges who could have ruled said I don't need to rule on the Canadian Charter. I'm ruling on and she was from Quebec. I'm ruling on the Quebec Charter, and that's enough for this case.
Right.
And it's basically, as I said earlier, our case is asking will ask the Supreme Court of Canada. Do you think BC residents shouldn't have the same rights as Quebec residents?
Right.
If they're suffering and dying on wait lists. We also, we talked about these exempt groups. We talked about workers' compensation being exempt and non-residents being exempt, but perhaps
seems like everybody's exempt except for the BC taxpayer, BC citizens.
Perhaps the most dramatic group that are exempted are federal prisoners. So federal prisoners have access to private health care.
Really?
Yeah, they're exempted, and so is the.
So if I have a bum knee, and I'll speak by personal experience, I'm now over a year still waiting for a consultation through the public system, whereas by going through Cambie, I was able to get in and see you in about 7 weeks or so. Yeah. The next best step would be, if I can't afford to do that, is just maybe go do a small crime, get myself a day worth in jail, and then while I'm there, I say, hey, I need to get my knee fixed.
Yeah, there was a cartoon on that where an elderly woman was behind bars in the cartoon, and she was asked by the jailer, "What are you doing? Why are you here?" And she says, "I've come in for a hip replacement." And
I mean, it's funny, but it's actually really not funny.
I think what happened with you can't happen today, because our injunction expired and the government wouldn't agree to renew it, and we didn't go back to court because we've had enough time in court. We're waiting for to hear what the appeal court says. So right now, if that happened, if you presented today, we couldn't do anything with you. You just
so
have to
I
wait.
got lucky getting in with the time that I did.
Because it expired on September the 30th. The
Wow.
one of the problems is that that we have to go to court is very expensive. It's one of the things
Brian, who's paying for all this?
Well, we have the Canadian Constitution Foundation is a national charity, and people have donated to that charity for us. And yes, one of the things that I would say, we talk about access to healthcare, but we have a constitution in Canada that really is ineffective because no single individual could ever afford to fight for their rights. It's too expensive.
Sure.
So to go to court and fight for your rights costs millions of dollars, and that means that the only people who could really fight for their rights are wealthy groups or people or groups like us that fundraise, and we did, and we're committed now, but it's been.
And you really believe in this, obviously. This is more than just what you might be able to do with Cambie itself.
Yeah, I mean, how can we be the only country in the world where it's illegal, where the government can say to you, we know you're suffering on a wait list, we know you might die, and we can't treat you, but by the way, we've brought in a law to say you can't do anything about this.
Right. That doesn't make any sense. But it seems to me that while there are people out there like myself who don't accept that as being reasonable, and I look for other solutions, and I happen to be fortunate enough that I can afford to make a phone call, get my doctor to call Cambie and go get that surgery. It's expensive. Most Canadians can't afford that. But I find it perplexing at the same time that we don't hear more people complaining about this. Is it just the media is not picking it up, or people just become very complacent? I know you commented earlier about Canadians are just too polite. Is that what the problem is?
I think that's part of it. And then, as I said, the numbers are low. But there is one of the arguments we hear is this is for the wealthy, but actually it's not for the wealthy. The wealthy, there is no country in the world where the wealthy suffer on wait lists. They go, as I said, you can go to the United States, you can go to Europe. Canadians who are wealthy have never suffered. One of the points I raise is we have well-known politicians who are on the public record as having used private healthcare for themselves, even when they would stand on a soapbox and say it's not good. But once it affects them, your outlook changes when it's you or your loved ones.
And does it include sort of left-leaning politicians like NDP?
Yes. We've had NDP leaders at our clinic, and
it's amazing.
And union leaders, and the instigator of this lawsuit, the group that went to court to force the BC government to start this action that we had to counter with an action rather. The BC Nurses Union has sent us patients. I mean, I've got checks from the BC Nurses Union, yes, but we cash them. But I've got the.
So then, where is the resistance? I don't understand. I mean, I just don't understand this. What are Canadians who are? If you were to listen to the people out there who are on the other side of the table, they're against this. What is their fear?
Well, one of the things they a lot of them are well-meaning people who believe that this is something for the rich. But as I said, if you have a care guarantee, it's for everyone. And if for instance, there is nothing to stop a government. So supposing the way the government and its public system can solve the inequality and the quotes inequity. By the way, we're ranked at the bottom in equity amongst by the world groups. But the way the government
medical care.
Yes, we're in the lowest inequity. And we have, in Stats Canada has data showing that the worst access and the worst health outcomes in Canada are in the low income groups. So we're not doing what we think we're doing.
Right.
But we, if the government really feels, so if you legalize private health insurance, and say, well, what about the poor? They need to be looked after. Those that can't afford it. Well, right now, if you're on welfare, you get, dental and physiotherapy and prescription drugs all funded, but the rest don't unless they have private health insurance. But there's nothing to stop the government saying they've got two solutions to the inequity and the unfairness. Make the public system good enough that actually there's no need for a private option because you're delivering care in a timely way, or else pay the premiums like they do in other countries, like they do in Switzerland and Holland, pay the premiums for those who aren't getting access to get access.
Right.
The solution is in the hands of government.
Those are two really valid solutions.
Yeah, and there's...
So what you're proposing, one of the options is just have more money go towards the cost of patients right to the hospitals. So either give the hospitals more money, which costs taxpayers more, or what you're proposing, one of the starting points is just get rid of the Ministry of Health in the province in the first place and go straight to the hospitals.
Yeah, but the other point on economics, because I know that's your field, is we know that it's actually cheaper to treat people quickly, but it's cheaper in the long term,
run, yeah,
but not in the short term.
Right, good point.
And governments only work on 3 to 4 year financial cycles.
Yes.
But governments need to plan long term, and they're not good at that. And we know that the economic cost of waiting for healthcare, that's why workers' comp send their patients to Canby.
Yeah.
Because
It's
they
amazing.
know
So
it's expensive to keep
BC
people
Nurses
waiting.
Union send people to Canby.
Yep.
Workers' compensation send people to Canby.
The Attorney General's office, which is the defendant in the case, sends us patients too.
This is amazing. What an irony and hypocrisy.
Yes, yeah.
There's the BC Health Coalition and Canadian Doctors for Medicare that say that your case is the most significant constitutional challenge in Canadian history. If you win, they state that you'll open the floodgates to a U.S.-style system that relies on private insurance and helps providers to set any price of care that the market will allow. Some of the things that they say, and one of them you already pointed out, is this will allow the rich to get access first. There's other comments about how this will move all the good doctors into the private system, so those people, the poor that you referred to, won't get care by good doctors but by poor doctors. And it will increase the price of health care due to this sort of arms race between insurance companies and pharmaceutical companies. Do you want to comment on some of these?
So the Canadian Health Coalition is a trade union funded lobby group.
Okay.
And they and their Canadian Doctors for Medicare were interveners in our case. We have had executives from the Canadian Doctors for Medicare treated at our clinic who also will stand on the lawns outside protesting against our clinic, and we've had the commonest single demographic of a patient treated at Canby is a unionized worker through workers' compensation. So this makes no sense whatsoever.
It doesn't make any sense. Let's talk about Canby and what you guys do. There's the specialist referral clinic and there's Camby Surgery. Can you just separate the two for me and explain what they're...
Yeah. So years ago, we started the concept of Canby in the early 90s and we opened in 96. And then I was involved in opening a clinic called the Visiting Specialist Clinic at Workers' Comp to expedite the treatment of injured workers. And it was funded completely by WorkSafe BC. And then I thought, after a few years, this is, if you're injured on the job, you're getting to see specialists, and we got the specialists from the hospitals to go to workers' comp and see patients. So the people who aren't injured on the job or aren't WorkSafe BC patients should have the same rights, and that's when we opened Specialist Referral Clinic. So they have a lot of the same groups involved, a lot of the same doctors, but all of the so what Specialist Referral Clinic does is it acts as a visiting specialist clinic for people who aren't injured on the job.
Okay, I see. And with respect to Camby Surgery, can you speak to some of the stats, like how many patients a year do you treat, and how many doctors do you have on your roster?
So we have over 100 doctors, and some of them, don't do. Everyone varies. Some people might only do 1 or 2 cases a month, or even less.
Mm-hmm.
Some do more. We have about 40 nurses who are. Most of them are part-time. A lot of our nurses we've brought back into the workforce. They were out. They were either semi-retired, or they were. Some of them were nurses with young families, and they can't do the overnight Saturday night stints that you have to do under the union rules in the public hospitals.
Mm-hmm.
And then there were lots of nurses who couldn't get a job. This is one of the paradoxes. They talk about nursing shortages, and but then they weren't employing nurses, and they weren't giving them jobs. And so we have actually increased the capacity and the flexibility of so they can come to Canby maybe once every 3 days and work, and you can't do that in the public system because the hospitals won't let you.
Right.
So and in Canby itself, since we opened, we've treated about 85,000 patients.
Wow.
Yeah, and
what kind of surgeries do you offer at Canby? Is it a combination of both? I guess you call it cosmetic as well as medical.
We do the cosmetic surgeries done there, but a lot of other surgeries like orthopedics and general surgery.
Mm-hmm.
We are not allowed to do patients. The government won't let us keep patients more than one night. About quite a long time ago, we applied to keep patients longer because we're capable of it, and the reason we wanted to keep them longer is we wanted to get into more longer stay surgeries and hip replacements and knee replacements and surgeries like that. And the government said they would look at it and get back to us in the next year, in the next 6 to 12 months. That was 13 years ago. We're still waiting.
This seems to span across not just a one type of government. Like it seems like you've had a challenge here, whether it's a BC Liberal government or a BC NDP government.
Well, I think governments generally are afraid of healthcare, and they shouldn't be. They shouldn't be, because, as I said, the Ipsos poll that was 2018 poll, so fairly recent, was basically asked the public. You're on a wait list, so should you be allowed to go to a place like Canby? And across the country, it was 76% said yes. And in BC, it was 80%. So this is an issue that resonates with the public, but the politicians remain afraid of it. And several years ago, I was in a debate. Not really a debate, but a round table with 2 former Canadian provincial premiers, Mike Harris and Ralph Klein. And they all, I basically stood at the podium and said, well, we've heard from Mr. Klein and Mr. Harris how they support this option because it's the right thing to do based on world experience. I said, but they were both in power, And when they were both in power, neither of them did anything to fix this.
Right.
And it's one thing and their response to that was that the timing was better now than when we were in power. So yeah, they're afraid of it. I mean, it's, people call it the third rail of politics, the electric rail in the middle. They're afraid of, and part of the reason they're afraid is that these groups like Canadian Doctors for Medicare and the health coalitions and the union organized groups, they want to keep healthcare as a public sector union operated run place. But the paradox there is that when we were opening Cambie in the early 90s, we had the union at UBC Hospital do a survey, a poll of their members, the nurses, physiotherapists, technicians. The unionized staff at UBC Hospital did a poll on how many would support what we're doing at Cambie, and of the members, 95% supported us.
Really?
So the leaders are out of sync with the members.
Wow. That's an amazing statistic.
Yeah.
So aside from your court cases, to wrap this up here, Brian, aside from your court case, is there anything else that could possibly happen that would make this system better? Because from my outside observation, being in my mid-40s now, having used Cambie twice in my life because I couldn't get adequate or care fast enough through the public system, it seems like the system as a whole is just getting worse. It seems like wait lists are getting longer. It's impossible to find yourself a GP. I'm talking more holistically, not just for surgery, but the whole medical system. So besides your case and being able to provide British Columbians and Canadians for that matter access to private medical care through your Camby Surgery as an example, is there anything else that we could see happen that will pivot this in another direction? And as maybe before you even answer that question, is my observation a reality of what's going on? Like, is it much worse than it was 20 years ago across the nation?
It's much worse. It's a crisis, and it's a crisis that will eventually force change, because right now the wait lists are growing and growing. We know the COVID factor has added to that. We know from hospitals locally that patients are being cancelled, still postponed, and they're never, there are claims that we'll catch up. They can never catch up. They can never catch up because they don't have the resources to catch up. We don't have the hospital infrastructure to catch up. We don't have the funding to catch up. So eventually, economic collapse of the system, which is already happening. To me, it's economic collapse when 308 people in one hospital region die in a year. You can't justify that morally or ethically, to my mind. And if you extrapolate that to Canada, I mean, multiply that 308 by I think Fraser Health looks after about 1.5 million people. So multiply that by 25 to 30, whatever the factor is.
Yeah.
And there are a lot of people dying on wait lists in Canada. And
it seems like if we even treated our general healthcare system with a fraction of attention that we have for COVID, we'd have a lot more people living. We'd have a lot more people walking around on the street, healthier, less pain. Is that a fair statement?
Yes. I mean, basically, you can get private health insurance. If you're a federal employee, you get funded for private health care. A federal politician, senators, judges can get funded for private health care. There's nothing to stop you going to your local vet and buying insurance for your pets, health insurance for your pets. So, and as I said, prisoners look at it. So we're asking that ordinary Canadians have the same rights that politicians, prisoners, and pets have.
That's a great statement. John Horgan recently got assessed for having some cancerous tissue or something on his neck, and I was questioning how he was able to get access to so quickly. Do you think John Horgan was placed on a fast-tracked list? I mean, did he get a chance to go to jump the queue, so to speak?
I honestly, I can't answer that, but I can tell you that lots of cancer patients are not getting treated quickly. I can tell you that generally in anywhere in the world, this is not a criticism of BC or Canada, anywhere in the world, VIPs get better treatment than the rest of us. I mean, that's the way it is. And
Sure.
And you know, I remarked once, I was quote I did an interview with the when I was in Ottawa once with the Ottawa newspaper, and I just happened to point out someone had shown me the admission chart at the Ottawa hospital, the main Ottawa hospital, and on the top right-hand corner of the admission sheet was a box to tick whether they're a VIP or not. This is a public hospital.
Really?
Yes, and you when you booked it, you had to tick whether they were a VIP. Now that was put in the Ottawa Citizen newspaper wrote that story up on the front page. A few days later, the VIP box was gone, but you know, the VIPs are still getting.
Yeah, absolutely. Well, I think I think a lot of people are realistic in knowing that if the premier of the province or a Canucks player needs surgery or medical attention, they get it right away. They're not waiting. But I think your point you just made a minute ago, which is trying to advocate for the same equal rights as prisoners and pets, is a really valid point.
Yeah, I mean, we have a German Shepherd, and I think that we actually had a vet. I interviewed a vet on this, and I said, if you had a German Shepherd and it was limping in pain, what is and needed a joint replacement, because they do joint replacements in dogs now. I said, what's the longest you could ethically keep that dog limping in pain like that? And he said, it would be against our code of ethics if we kept them waiting longer than a week. Well, humans are waiting 1.5 to 2 years limping in pain, and that's not right.
That's amazing. Well, Brian, I appreciate you coming in today.
Okay.
Brian Day, Medical Director of the Specialist Referral Clinic in Camby Surgery Center, and at the forefront of a court case with the provincial government that's been going for a better part of how many years now? 10 years?
Yes, 2009, so it's
12 years.
January of 2009 is coming up to...
And a toffee, and an Everton supporter. If you're ever going to see Brian, make sure you're wearing blue and not red. Brian, thanks for coming on the show today. Really appreciate your time.
You're welcome.
Okay.